Good morning, Mr. Chérez. Good morning, audience. And also good morning to those that are present online. Streaming this ceremony will be streamed, and I hereby open this academic ceremony in which Mr. Chérez will defend the academic thesis entitled Information and Communication Technologies, New Challenges for Patients and Healthcare Providers. Before we go to the opposition, Mr. Chérez, I would first like to introduce your supervisors. Mr. Dr. Gavilanes, he's a neonatologist at the Maastricht University Medical Center. Likewise, Professor Zimmerman is also a neonatologist at this university. And then Dr. Chedraoui, who's present online. He's a gynecologist and obstetrician at the Universidad Espiritu Santo in Ecuador. So I would like now to ask you to introduce your major findings to the audience in a brief presentation of about 15 minutes. Please, floor is yours.
Good morning. I would like to thank the Prorector and highly esteemed opponent for giving me the opportunity to present my thesis today, and I will appreciate the presence of all of you. Let's begin with the definition of ICT. The information and communication technology are all of the tools, systems, devices used to collect, process, transmit, and share information through electronics means. That include TV, social media, radio. The main components of ICTs are the hardware, the software, networking and internet technologies, telecommunication, and multimedia. Why is it important to know about the ICTs? Because they help to get the patient more involved in healthcare. They improve the communication between patient and physician, and telemedicine is part of the ICTs, and all of this enable healthcare outside regular clinics. Telemedicine refers to the use of ICTs to provide medical service remotely, like diagnosis and monitoring patients. The rapid diffusion, low cost, and general availability of ICTs make them an attractive platform to management care, communication, and intervention as a part of self-management education. However, in Latin America, we lack knowledge about how these tools are used, accessed, and accepted. I would like to tell you why I decided to make my thesis on ICTs. In 2014, I was invited to participate in an international meeting to talk about the ICTs on chronic obstructive diseases. It was a challenge for me because due to the lack of knowledge, the studies in this time, especially in Latin America, and all of that gave me the opportunity to present a research protocol to my thesis. Please follow me to this journey. ICTs are categorized in this following way: one-to-one dialogic, such as SMS, WhatsApp; one-to-many informative, such as YouTube, web browser; and many-to-many social, such as Instagram, X, and Facebook. The aim and outline of my thesis was to explore in Ecuador and Latin America the knowledge, perception, preferences, frequency of use, and barriers of ICTs for the management of relevant chronic diseases from the perspective of patients and healthcare providers. The diseases that we solved were, in the order, asthma, COPD, cancer, chronic urticaria, sleep apnea, and allergic rhinitis. Additionally, we asked to the physician how frequently use ICTs in the day-to-day life. And I'm very pleased to present the principal results. When the patient look for information in the ICTs, they prefer web browser. In contrast, when they would like to ask to the physician or receive information, they prefer one-to-one ICTs. Patients with higher education and your age have more predisposition to use ICTs, and especially in this disease, chronic urticaria, they are very interested to use an app for activity and control of the disease. However, patients with having allergic rhinitis, together with another disease, for a long period, reduce the likelihood to use this tool, to use the useful of these tools. Another principal result, physician or healthcare professional prefer to use WhatsApps and Facebook for communicating with their colleagues and interacting with the patient. What the matter in telemedicine? There is a low, the physicians are low familiar with telemedicine. However, despite this, they consider that telemedicine can be effective in reducing cost, saving time, and provide faster and better medical care. Finally, when they are searching scientific information, the main source was search engines, such as YouTube and Google. This is the frequency of perception among Ecuadorian physicians. We found that those with the highest percentage were in relation to the perception was participate in research projects, promote health, and working in group with colleagues. In relation with the frequency of barriers, the physician was they're very concerned about the privacy and security in personal and patient information, and I refer that they dislike, not have time to use ICTs, and I don't have time to learn about CTs. I would like to present that in 2016, in a collaboration with the Urticaria Center of Reference of Excellence worldwide, we developed a study called Curic study. And we found that 96% of patients with chronic urticaria have access to ICTs and use this regularly. Patients with a shorter disease duration have more interest in to use ICTs, and patients with chronic urticaria are more interested to use apps for monitor activity and control of the disease, especially who have comorbidities. What was the conclusion of our study? That we needed to develop a CU-specific apps to monitor disease activity and control. Hence, the Cross app was born. This is an app that uses patient-reported outcomes to measure the activity and quality of life of the patient and help the physician to follow up the patients. I was honored with all of this information. I was honored to be a part of the International Scientific Advisory Board, and currently this app has been downloaded by more than 22,000 patients and is being used in 43 countries worldwide. Moreover, thanks to this app, many research papers have been developed, allowing a better knowledge of the disease and facilitating a more successful outcome in the management of patients with chronic urticaria. For example, we found that women and patients with more severe of the disease have a higher predisposition to use this app, and the most frequent trigger factor for exacerbation of chronic urticaria was stress, skin rubbing, and high temperatures. We have more chance to prevent the disease. Moreover, a physician can determine if treatment changes are required in real time, without the need for long waiting times for appointment. The time with a patient with chronic urticaria wait for a next appointment with a physician is approximately between 3 to 6 months. I'm using the urticaria control test. The physician has the chance to optimize the treatment and included stop the treatment. Finally, we develop a patient information platform, and the patient have chance to receive an update of the disease. We know that the artificial intelligence is the future of precise medicine. It's divided in machine learning, deep learning, natural language processing, and large language model, LLM. We try in this moment, when we look all of the artificial intelligence and getting involved in ICTs and continue our journey, it became necessary to work on new research about artificial intelligence. And then, first of all, we look the model, in this case, ChatGPT, how ChatGPT is accurate when the patient look for the information about chronic urticaria. Using validated tool, we confirm that we look the quality, the reliability, and readability of this model about the urticaria. After our study, we confirmed that the information in the model was not reliable and is difficult to understand. You need to have a college level to understand these answers. Then, as a result, we developed our chat model. We put the name of Eidus, intent to create more accurate information to be obtained when patient asks about chronic urticaria. This is a screenshot of the Eidus. It's an option for patient or physician, and there is a field for user to put in the question of concern. This is possible to look the scientific sources that provide the basis of the chatbot answer. And finally, there is a pool of frequently asked questions for quick and direct response. Recently, we present and we demonstrated that our chatbot Eidus is more accurate than ChatGPT, 95% versus 86%. This is my final conclusion. ICTs are very useful in the management of the chronic diseases. It improves the relationship, the communication between physician and patient. Our results help to design new strategies to increase the knowledge and frequency of use among physicians. Cruise app is very useful in the management of chronic urticaria. And last but not least, for better use of technology, we need that the technician need to be more in touch with the physician in order to create a patient-friendly ICTs. I would like to thank all of my supervisors, especially for my friend Antonio. My sincere gratitude for your guidance and support throughout the completion of my thesis, your expertise and constructive feedback, patience, and for always to be together with us was very invaluable in every stage of our work. Working with you was a privilege, and I feel that I have been gained a friend. And thank you for all of you for your time. And finally, I would like to thank my family, my reason for living. Thank you for all of you. I go back the word to the prorector.
Thank you, Mr. Chérrez. Thank you for this clear overview of your results. And also, congratulations with all the achievements during all these projects that you presented. We will now go to the opposition and defense of your thesis. Of course, there are always questions that remain. Your thesis was assessed by an assessment committee already. It was assessed positive, and that's why you're now allowed to defend your thesis. And the defense will be, and the opposition will be initiated by Professor Driessen. He's a professor of pediatrics at this university. Professor Driessen.
Thank you, Mr. Prorector. Mr. Candidate, first of all, I would like to congratulate you with this impressive work and also involve your supervisory team in this. Congratulations. Very nice to read your work. I liked chapter 4 about the generations, because we all have parents and children and generations. How generations use communication technologies is very different. And in your chapter 4, you see that the elderly, are less likely to use communication technologies. And at the same time, that's the group they have most of the chronic medical conditions, the elderly. So my question is, should we just wait for the next generation to implement it, or do you see possibilities to implement communication technologies in this group right now? And how would you like to do that?
Highly esteemed opponent, thank you for your question. It's a very important question because, in our opinion, we have a chance with this generation. Why? Because all people with chronic diseases, they have sometimes feel to be isolated because they have a chronic condition. I sometimes feel bad, and all of patients with chronic diseases have more chance to develop a mental health. And we need to help this patient. How? Using the technology. And there is 2 important papers published last year, a meta-analysis, where they demonstrated, for example, in COPD, the old patient who we send information for rehabilitation, or we send information how he have chance to use the inhaler, the medication. This kind of patient have more chance to adherence to medication. We need to teach them how to use the new ICTs, because this kind of patient don't use all of the smartphone, all of the application smartphone. They only call and receive information. But in our opinion, this is a good opportunity for physicians, for the government, or for who are involved in the chronic diseases.
And how can we achieve that? How would you like to achieve that, to educate them?
Educate using, that they prefer to use, in all age, they prefer to use SMS, email, and now WhatsApp. Because, for example, in South America, the telecommunication companies included WhatsApp and Facebook free. And the patient have more chance to use this. And now the old people it's now using more WhatsApp than 10 previous years. And it's easy to send through WhatsApp a video, to send a message. And sometimes, I know that it's different between physicians who work in a public hospital and a private hospital. But in our case, our patient, we receive always a message for WhatsApp. And when we respond then, send a message, we remember how to use the inhaler medication, how to use the exercise. And the real problem is what is the time we need to use the message. Because when in WhatsApp, in Twitter, for example, TikTok, the only time that the people would like to receive the message is for 30 seconds.
Yeah. But you still see possibilities for this generation, the older generation, to develop.
Yes.
All day, yeah. And I'm a pediatrician, so also interested in how children can use it. So you don't comment so much in your thesis on children and communication technologies. What do you think about children? From what age can they get involved?
The children use the smartphone more frequently than all of us. The parents said, okay, you have a time to use that. But the message is for the parents. In our clinic, for example, all of parents with his children have asthma. Always we say the parent how to use the medication, how to use the inhaler medication, the inhaler therapy, and to remember all of the trigger factor for the allergy. For the children, or remember that in different countries, they block to use, for example, different ICTs less than 15 years old. Mm-hmm. And we guess that it's important to the influence in the school, because in the school you have more chance to use a video, how to use the medication, how to recognize the trigger factor for the food allergy, and this is the
so they are the digital generation. So that will be okay. And you're talking about asthma. One of my questions was whether this app is already operational with the chronic urticaria, but you just showed it to me, so that's very, very nice. I think asthma is also a disease that can be in a similar way as the chronic urticaria managed with an app. Do you have any ideas how for asthmatic patients you can either develop an app? What should this app, what can it do? What are the advantages of an app for asthma?
Thank you for your question, because there is an important app. The name is Maastricht. Maastricht is an app from allergic rhinitis and asthma. And including there you have this app, a new tools, a new survey. The survey, the name is DASMA. You have chance to measure, using this app, what is the severity of the disease and how the patient have more chance to change the medication or call the physician. This app includes different patient-reported outcomes and now include advertising with the climate change. When we are more pollen, they send you information. This is one of the most useful or the most frequently used app, Maastricht. But there is another app because this more frequently asthma to chronic urticaria, and there is a lot of apps for asthma.
So when you look at your thesis, you don't focus on specific custom-made apps for diseases. But is that not the future of communication technologies, rather than the general WhatsApp and SMS, rather the focused applications with specific apps? What do you think? Should we make for every disease an app? Or should we just use WhatsApp and other platforms in general?
In general, if we divide it for the cohort generation, the generation C and millennium prefer for receiving information Facebook and Instagram, and to ask for the physician to receive to Twitter. We need, for instance, my final conclusion is we need to think in what cohort we would like to work.
Thank you. Thank you very much for your answers, and I'll give the word back to the pro-rector.
Thank you, Professor Driessen. Then the opposition will be continued by Professor Strick. She is a child psychiatrist at the Maastricht University Medical Center. Go ahead.
Thank you, Mr. Pro-Rector. Dear candidates, I would like also to congratulate you with this thesis. Also your supervision team, I would like to congratulate. I think it's a very important topic you addressed, very modern also, and you evaluated both patients and caregivers, so I think it was very well done. And in a you wrote a comprehensive thesis, so I'm impressed. So again, congratulations. I would first of all like to discuss with you Proposition 6. of your thesis, and I would like to ask your paranymph to read out loud Proposition 6.
Okay. A trust-based patient-physician partnership grounded in open communication and shared decision-making is essential for effective chronic disease management.
Yes, thank you very much. So I'm a psychiatrist, so I think communication and shared decision-making, but especially communication is very important in the relationship patient-caregiver or health professional. And in psychiatry, the connection between the therapist and the patient is the most important factor for effective treatment. And I'm a little bit worried that when we use ICT in chronic patients, that factor could be lost. So I wondered whether in your, for example, chapter 16, in which you evaluated health professionals, whether this item, this factor came up, that the health professionals did mention this, that they did not have connection, and if not, how do you think about this point in clinical practice?
Highly esteemed opponent, thank you for your question. This is a very important question because always the physician believes that in the future we could lose the relationship with our patient. There is a public publication 15 years ago in respiratory disease. They asked the patient what the patient expects for their physician. And they answered that they expect three things. Look that the physician look their eyes, the physician have time to listen, and finally that the patient look that the physician try to resolve the problem. Always with this that, in our opinions, never artificial intelligence or ICTs will change this. Always the patient need to be in touch, to look for the face to their doctor, to talk, because we have a partner. All of the physicians who have chance to have involved in chronic diseases, sometimes with our patient, we are not only patients, sometimes we are friends. I mean, especially in psychiatric problem, that is very important because sometimes the appointment is very long, and patient with mental health need some time to be in touch with physician more quickly. For instance, in chronic diseases, I would like to talk about chronic urticaria because we have a different paper in this. Last year, a physician from Charité demonstrated that chronic urticaria the patient with chronic urticaria more 10 years have more chance to mortality. This is the first time that you say chronic urticaria with mortality. Why? What were the most comorbidity in relation with the mortality? Suicide intention or intent on suicide ideation, and cerebrovascular disease. Suicide ideation is very important. The prevalence of mental health in chronic urticaria is approximately 30%, and we demonstrated 2 years ago that alexithymia, the incapacity to express emotion, the prevalence in chronic urticaria is 40%. And now we are working with psychiatrists and psychologists in a new study. The name is ABT programs, attention-based training in chronic urticaria. This involves to artificial intelligence. We have chance to communicate with the patient, and we believe, and I'm very sure that in the future, controlling the mental health, the patient have more chance to decrease the activity of the disease, and we believe now we are working, ongoing a new study for a cohort in all of patients. Now we are trying to look what is the real prevalence of suicidal ideation in chronic urticaria. And in this patient, we have an intervention, and after that, we try to confirm that we have a chance to decrease the mortality.
Yeah. It's very interesting. I'm very pleased to hear that you also address the mental health issues, because we know these are very high comorbid in chronic disease. I also think that so this can be an advantage, but also a disadvantage, because, for example, you also have patients in chronic disease with a lot of anxiety. So depression is one of them. You told about that, but also anxiety. For example, patients with asthma who are afraid that they get another attack, and they are going to look up everything on the internet or on ChatGPT or something like that. So it could also be, when you use a lot of ECT, that those patients get overstimulated and feeling complaints, or can be over-medicated. And also do not trust the healthcare professional, because they read something else or see something else on YouTube or TikTok or something like that. How do you think that can be addressed, this over-medication or over-information of the patient?
This is a real problem. I don't have exactly the correct answer, but I would like to say two important things. That now there is a new science, epidemiology, and epidemiology is the science to look how the people are using the information, and we have chance to using the Google Trend and different the value of research queries. We have chance to look how is changing the query in the internet. The real problem is we have a lot of infodemia, fake news. The patient receive all of kind of information. For instance, we are involving in improve the information from ICTs. In our study, we found, for example, that the second more web browser, the second more ICT used for look for information is YouTube. And the information in YouTube sometimes is not accurate. Mm-hmm. Then the society, for example, in our situation, UK, Galen, are preparing more accurate information in YouTube. Yeah. And always in all of chronic diseases in our patients, we recommended the sites with the accurate information. Talking about the mental health, because we love to talk about this. In patients with chronic in COPD, emphysema, and chronic bronchitis, 15 years ago, a physician developed a model that tried to look what were the diseases more associated with mortality in COPD. And the most frequent disease associated with mortality is anxiety. Yeah. And after that, this is a new change for the pulmonology, because the pulmonology said, how anxiety we have more risk to the mortality. And now, all of the pulmonology, we are very looking for a patient with anxiety to say, no, we need to go to the psychiatrist, because anxiety is very associated with mortality, and more to hypertension, more sleep apnea. For instance, we guess, and we were involved in the different society to improve the accuracy of information, because that is the
I think I lost some time.
Yes.
Yes. Okay. Yeah. Okay. Yeah. Thank you very much. I would like to discuss this afterwards with you. Thank you.
Thank you, Professor Strick. Then the opposition will be continued by Professor Figueiredo. He's present online. He's a professor of pulmonology at the State University of Feira de Santana in Bahia, Brazil. Professor Figueiredo, the floor is yours.
Mr. Chair, esteemed members of this committee, colleagues, and dear candidate, first I would like to congratulate the candidate for his comprehensive dissertation, which examines the role of information and communication technology in the management of chronic non-communicable disease, with particular attention to respiratory conditions. I guess this dissertation brings together a substantial body of empirical work conducted across diverse population in Latin America, and also address topics of increasing relevance for contemporary healthcare systems. Notably, the candidate demonstrates a strong and nuanced understanding of the study subject matter. My questions will focus on conceptual framing and methodological choices of the thesis, as well as on the clinical and public health implication on implementing ICT-based strategies in the management of chronic respiratory disease, especially asthma. So my first question for Iván Chérrez would be, it's well known that patterns of ICT use and diffusion have not remained static over the last decade and may evolve in response to technological advance, policy changes, and also broader social shifts. Consequently, their observed association would be interpreted as a snapshot within a specific time frame rather than an evidence of a longitudinal trend. So please, Dr. Chérrez, what are your thoughts about the diffusion of ICTs for healthcare stakeholders in South America over the last decade, and how far can we reach in the future?
Highly esteemed opponent, thank you for your question. I understand that you asked me that how we can diffuse all of the ICTs in Latin America.
Yeah, because we have some great particularities in South America. We have rural and underserved populations, and how can we reach this underserved population? How can information communication technology can contribute for more inclusive healthcare assistance for these populations, for example, and how far can we reach in the future with these technologies?
I guess that the first, in my opinion, all of the society, allergy, pulmonology society, pediatrician society, need develop a union to prepare all of the information in only one way. Because if the patient have a lot of information and diversity of comments, sometimes it's difficult for that. Especially in asthma, this is a new idea in Europe. They prepare a guidelines, they prepare a statement with different society. In my opinion, first of all, we need to prepare in our in Latin America. We are different from Europe, from USA. We need to understand our culture, and after that we prepare information in this way, because the grand chance that we have now is that all of the ICTs changing very quickly with better way, because we have more chance to use more easy. And then when I was studying all of our paper 10 years ago, WhatsApp doesn't exist. Now WhatsApp, Facebook, Instagram, in TikTok, we don't have chance to look how is the TikTok model, but we think that there is a communication. Listen to this idea. The communication with the influencer, because we are a physician. We said, please, you don't need to use that or that, but the people believe more that influencer than the physician. And then that is the good opportunity to mix this, the information for a good health, for to be increase the better outcome in our patient, need to be shared with the principal influence to prepare information, good information that we have sent to our patient or our community.
That's great, thank you. My next question is, some degrees of heterogeneity in questionnaires and study populations is expected in research involving multiple chronic disease. However, this variability complicates complex cross-section study synthesis and comparison. So in what extent does this heterogeneity limits the generability of the conclusions across different chronic disease contexts? Because you present your data about a broader spectrum of chronic disease. So can we generalize your findings for other kind of chronic disease?
Thank you for your question. Yes, we believe that we can generalize our results, but do remember that cross-sectional is a study that not demonstrate cause-effect. The real study in the future will be a cohort study or clinical trial study in order to demonstrate if using ICT is better to use a conventional method. However, when we analyze all of the chronic diseases, when we compare the two frequent chronic diseases, hypertension and diabetes, we looked at how the patient use the ICTs is very similar. We guess that in the future, we have chance to applicate all of these ICTs in the chronic diseases. There is a recent meta-analysis in heart failure when they demonstrated that using ICTs, the patient have more adherence to the treatment. They're more interested to continue using the medication.
And my final question is about ethical and privacy considerations related of ICT's use. What are your personal concerns regarding the sharing of patient data through these channels, and how do you believe that such concerns should be addressed in future clinical and research settings?
Highly esteemed opponent, this is an excellent question, a very important question, because I guess this is a really dangerous to use the information through ICTs. If we believe that, for example, a medical assurance, yes, medical, all of the who are involved in health, to receive information that say that you have 2 or 3 diseases, probably when to try to renew your application, this could be difficult. Now, we are not sure if all of this information could be very safe. Remember that during the last 2-3 years in a hospital, there is a hacker to obtain all of the information, and probably it's very dangerous to use this information. We believe that in the future, we hope that the information could be more safe to be, all of the application will be more safe to share the information. But at the moment, always we are very concerned how this information could be used, if not in a ethic consideration.
Thank you, candidate. I have no further comments, Mr. Chair.
Thank you, Professor Figueiredo. The opposition will be continued by Professor Gazzolo. He is also present online. He is a professor of neonatology at the Chieti University, Italy. Professor Gazzolo, floor is yours.
Thank you, Prorector. First of all, I want to congratulate candidates for this very huge and extensive thesis, providing new insights also in communication that can be extended to all medical disciplines. I want also to congratulate the promoter team for their tough work in this thesis. And I really appreciate all the contents of the book, and also I appreciate the list of limitations that the candidate provided to us. In this setting, I would like to ask to the candidate, look into the limitation of the studies that have been conducted, if there are other limitations which are the point of improvement of the ICT in this daily life.
Could you repeat, please, the question, please?
You provide a limitation of in your study, in your published paper, there are a list of limitations that you provided from ethical to system of ICT web that have been used. And the question is if you would like to upgrade the limitation of ICT, and which are the points that can be improved in the near future?
High esteemed opponent, thank you for your question. Now we have a good news. After 2017, there is a changing evolution of artificial intelligence using the large language model, such ChatGPT, DeepSeek, Gemini, because they use a new algorithm. All of this information change the use of ICTs. Now we have more chance to incorporate all of the new information, all of the best quality of research, and put in the new develop of ICTs. I am talking about especially artificial intelligence on chatbots. Now, for example, the chatbot 3.5, the hallucination of that was approximately 40%. And now, with the new ChatGPT 5, the hallucination is less 7%. I guess that there is a good news for the new development of information and communication technology, and we have a chance to increase the knowledge of the ICTs, not only in the physician, but in the patient, and how the patient will use this technology more frequently. The evolution of that artificial intelligence permit us now that when you check in the Google, for example, you have a chance to use a Gemini, because Gemini is part of the Google, and you receive some of information. In some time, it's good information for the new ideas, the new information for different diseases. And I guess that is my opinion, that in the future, this will be better artificial intelligence to receive excellent information.
Thank you. One of the main points of this way of achieving knowledge is that sometimes and more often there are very debated results. For example, there is a confusion or there are a mistake in providing information with this system, because as you know, more than me, AI is a growing system. It's a growing system, and sometimes, especially in the scientific field of interest of every topic, some false communication, some false news can be achieved. What do you think that we can correct this weakness point?
You said with that form. Would you repeat the last? Please, would you repeat?
This artificial intelligence information sometimes is lacking or is wrong, because artificial intelligence is a growing system, achieving information by all the devices, all the systems, and sometimes this information is not correct.
Yes.
And this is one of the main points that can be very dangerous on the patient quality achievement.
Okay. Highly esteemed opponent, thank you for the question. Now I understand. I have to comment of this. Last year, we published a paper when we compare the two artificial intelligence, ChatGPT versus Gemini in pulmonary fibrosis. And we demonstrated that Gemini is better than ChatGPT. We know that for the majority of us, we have this concern. Is artificial intelligence give us the correct information? If we talk 3 years ago, probably I say, okay, I have more concern. But now, when the new changes, the accuracy of some artificial intelligence are increased in different topics. For instance, we developed a chatbot in chronic urticaria, and now we are working in a new chatbot in pulmonary fibrosis. In our opinion, the societies, the community, the scientific community, need to be more in contact with the engineers to develop more accurate information, because that is the only solution, because the people don't prefer sometimes to choose the scientific society to look for information. They use quickly Google or any kind of this. And the physician use them. The physician prefer to use Google and Yahoo instead of more scientific web browsers such as PubMed, Update. Now we have the opportunity to prepare more accurate information, developing a new chatbot. Fine. But then the difficult now is that when we learn more about large language model, there is a black box when we use, there's a different part when we prepare a chatbot. One of these, if the line chain, we need to look for the different algorithms. And when we look this algorithm, it's very surprising, but sometimes we don't know how the large language model choose the information. That is the really problem now. But we believe that in the future, this could be changed because there is a more quickly and more safe algorithm in large language model.
Last point, a curiosity. I really appreciate the correction for age in the use of different ICT models. And I wonder whether you think that it's useful also to correct for gender.
Correct for?
Can you repeat the question, please? And then please answer the question very briefly.
Yeah. In your publication, there is you corrected, you stratified the use of different ICT system according to age. And the results are confirmed that younger are much more point to the new chat intelligence, artificial intelligence instead of SMS or something else. I wonder whether you think it should be useful in the near future to correct also for sex, for to see if a male or female use different ICT systems.
Yes, thank you for your question. The female have more interest in to use ICTs. We demonstrated in different studies. And second, there is a different, when we look for the cohort age, the baby boom, asylum people, they are less familiar with the ICTs, and the Generation Z millennium, they have a digital age. There is a new group, they born with the digital, all of these tools, and the thing about this is very different than the another cohort. For instance, we need to put focus in what kind of ICT we need to develop, depending of what kind of age we are looking for the benefits when we use ICTs.
Thank you. Now I move to the prorector, and thank you for your answers.
Thank you, Professor Gazzolo. The opposition will be continued and finalized by Dr. Villamor. He is an expert in neonatology at the Maastricht University Medical Center. Dr. Villamor.
Thank you very much, Mr. Prorector, and I would like to start by congratulating the candidate and also the supervisory team. We don't have so much time, and I would like to finish introducing some philosophical questions. Perhaps it's good to finish your defense. I am concerned about the fact that you mentioned it a couple of times, how you can detect the pitfalls, for instance, ChatGPT, of the mistakes that they make, because you have critical thinking. But now the new generations are delegating the critical thinking and even the use of language to ChatGPT or to other tools that we have with artificial intelligence. From the moment that we don't have more people with a good development of critical thinking, they are not going to be able to detect that. The part is, my question is, how important is that delegation of important conditions of human beings, such as critical thinking or use of language or communication, to ChatGPT or to other tools similar to artificial intelligence that are in constant development and constant improvement also, learning from the mistakes, but from a moment, perhaps this circle is completely closed. This is my question.
High esteemed opponents, thank you for your question. That is an important question because we have a challenge now. Last year, we asked how the students and the physician are familiar with ChatGPT. It's similar to students and physician. Only 40% of the physician study and students know about ChatGPT. However, they would like to improve the knowledge. Less of them have confidence using ChatGPT to receive, or they believe that they are receiving a good information. However, they use day of day. The question, in our opinion, is that we need to teach our student, our physician, how to use in correct way a ChatGPT or any kind of large language model, because we need to know how use the prompts, how we put the words, how we need to to develop a structure to present the good information, the good question, excuse me. Because when you ask a good question, we receive a good information. The other important point is that different large language model, one is free and other is we need to pay. When you use the paid form, is better. In ChatGPT, you have a part, the name is concern. This, when you put in concern, you receive more accurate information. Included, you receive the paper where we have all of the information. And you have chance to check the paper, is the correct the information. In our opinion, all of the large language models are useful in our day-to-day life because they give some ideas. But if we believe that all of the information is incorrect, that is the problem. And we need to check always all of the information. That there is a new different tools, sites, ChatGPT, always not only for the general information. It's included for a physician to use a good information. At the moment, I will believe that this is we are in a method of all of the artificial intelligence. In the next 5 years, probably we have better large language model. Because when we look back, I remember ChatGPT 3.5, 40% of hallucination. We receive information and we check, don't exist. Now, ChatGPT 5 is very different. DeepSeek, from China, Gemini, and all of day we are looking for new information with new large language model. My final recommendation or conclusion included for me that if we feel that in the future we will be young, we need to using more large language model because it's the only way to are changing, we are thinking how we use a correct information in the future.
Thank you very much. Just a last question, very practical. For the medical world, recently we have specific artificial intelligence tools such as Open Evidence, I assume that you know, and has been described as a game changer. Do you think that is a real game changer for us as physicians to have tools like Open Evidence? I'm not talking about patients, I'm talking about us as physicians.
Open Evidence. I don't use frequently that. I prefer to use another, but Open Evidence is a good form to use these tools. I guess that when we receive all of the information for our resident and for our physician, always.
You may briefly finish your answer.
And I guess that we need to be always thinking that the good information in this platform, good Open Evidence update, are very useful and very accurate. Okay. I would like to give the word back to the.
Thank you, Mr. Chérrez. The time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and the quality of your defense, and I request that you and your company await the results of our deliberations and our return in this room. Mr. Chérez. The degree committee here present has assessed the quality of your thesis and the quality of your defense. In view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Dr. Gavilanus is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your supervisor now to take the floor.
All right, please.
Do you promise to work in accordance with the principles of scientific integrity at all times? To be careful and honest, transparent, independent, and responsible?
I promise.
By the authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Iván Chérrez-Ojeda, the degree of doctor and grant you all rights attached by custom and law. As evidence of this, I now present you with the degree certificates signed by the rector, the secretary, and the other members of the committee and affixed with the official seal of the university.
Please be seated.
Dear Iván Chérrez, MD, PhD. Dear Iván, first and foremost, I would like to congratulate you on the outstanding way in which you defend your dissertation and on the quality of the work that has been awarded a doctoral degree at our university. We have known each other for 8 years. Since the moment we first envisioned this PhD project together, what began as a shared vision has grown into a solid, mature, and impactful scientific contribution. You have established a highly successful research line, combining academic rigor with clinically relevant investigations. Throughout the development of this project, you have managed to balance demanding clinical work and responsibilities with research and educational commitments. The work you have defended today also lies a solid foundation for future collaboration between your institution in Guayaquil, Ecuador, the Universidad Espíritu Santo, and our university. This PhD does not mark the beginning of your career. It recognizes a lifetime of meaningful contributions, and I'm confident that I will open the way to new and impactful work in the years to come. It has been a true honor and a privilege to be part of the supervision team, together with Professor Zimmerman and Professor Chedraoui. Finally, I would like to extend my congratulations to your close family in Ecuador, whose support and encouragement have been essential throughout this journey. I give the word back to the prorector.
Highly esteemed Dr. Chérez, it is my great pleasure and honor to congratulate you on behalf of the University of Maastricht and the Board of Deans with the degree that you have acquired. I also, of course, would like to congratulate your supervisors, Dr. Gavilanus, Professor Zimmerman, and Dr. Chedraoui, and of course your family, your close family, your partner, Jacqueline, I understand, your children, and also your parents. And I hope that they are listening in through the stream. I don't know, it's still early, I think. Also, I would like to congratulate all of those that have collaborated with you on the different topics and published with you papers. Research is never done alone, and I think some of those might also be listening in online. With respect to what has been said about your thesis and your defense in our deliberation, I can state that we are all impressed. It's an impressive book and impressive work, very relevant work also, important for the implementation of AI into patient care, into patient participation, and shared decision making. As far as your defense is concerned, I think it was a very academic discussion. You defended your work in a very academic manner. A clear introduction for the layman's public. And you also introduced us during the discussion with new information that is not even in the book. So you have you showed a very broad view about the topic, broad look, and you showed deep knowledge of the topic, and also anticipated on new developments. I wish you lots of luck in your future career. I'm impressed by your achievements already, lots of publications in your work. But again, lots of luck, congratulations again, lots of luck in your future, and lots of happiness together with your family. Before I close this ceremony, I have a few announcements. We will make some pictures here with the opponents that are online present on the screen, and also your supervisor. And after that, we will leave and make some pictures, additional pictures at the staircase in the front of the building, and we will congratulate you. Also, before we leave this room, I would like to give your the opponents online and your supervisor online the chance to congratulate you. Having said so, I close this academic ceremony.
So you can come in the front.
Go ahead.